Hello and welcome to Health Matters on Channels Television. Thanks for being there. I am Mary Alale Yusuf. Globally, there were over 79.8 million confirmed cases of COVID-19 on Christmas Day of 2020. Recoveries were over 45 million, and there were more than 1.75 million deaths. In Nigeria, cases rose to over 82,700. There were over 70,000 recoveries and 1,246 deaths. Recovery rate is down to 84.9%, and fatality rate is 1.5%. Antimicrobial resistance, or AMR, occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines. This makes infections harder to treat and increases the risk of disease spread, severe illness, and sometimes death. Dr. Tajuddin Bamdele is in the studio with me. He's a research scientist and molecular biologist at the Nigerian Institute of Medical Research. You're welcome to the show.
Thanks for having me. Merry Christmas.
I wish you the same. Now, first of all, we have a new COVID-19 variant in Nigeria. This mutating of the virus, is it a mutation? Let's even know.
Yeah, there was the demonstration put forward by the man in a day, Professor Happy.
Yes.
Just a few days ago, he alerted the nation because I've been doing work on sequencing. Even my own institute have been doing that, but we have not been able to demonstrate or confirm new mutants. There are mutants based on what is shared with the learned world. That there are mutants.
Yeah, mutants.
And the mutant we have in Nigeria that was coded that way is not the same as the one we have in UK.
Yes.
Neither is it the same as the one we have in South Africa.
So they are all different variants or mutants, as you call them.
They are mutants because over time, maybe there's a shift in the particular segment of the genome. When you say something mutate because there is misalignment or wrong alignment on what we used to know about the genome.
Okay, maybe so it's like a freak accident?
Something like that.
It doesn't have anything to do with resistance.
Mutation can cause resistance, and there are different mechanisms of resistance. There are different things that can cause resistance. Overuse or misuse of drug can cause resistance, antimicrobial resistance this time around. Lack of surveillance over time, people just just throw caution to the wind and take drugs anyhow. Even though they can take the drug in subtherapeutic doses, that can cause resistance. When you have drugs that are manufactured and given to us that are not up to the USP or not up to the concentration that should be taken to ameliorate that disease in question, there can be resistance.
Okay, they said there was a study, WHO spoke about a study of several studies collated together, and they brought up results that 72% of the patients got antibiotics, but only 8% of them actually demonstrated bacterial or fungal superimposition of COVID-19. So those were the only 8%, but 72% got antimicrobials. Is this a problem?
It is a problem. Are you talking about antimicrobial resistance?
Yes.
No, even globally, apart from that, globally, we know that 700,000 people die every year
due to antimicrobial resistance.
Yeah, 700,000 people die.
700,000.
Whopping 700,000. And in the next few years, up to 2050, you'll be counting 10 million people dying out of this menace.
You're making a projection now.
We project even before we get to this 700,000. It was projected. We were just sleeping. But now we are there, 700,000 people. I just look at a single human being dying out of AMR or misuse of drugs. Now we are talking about 700,000. It was projected some time ago. Now we are now projecting 10 million people dying out of misuse of drug in the next few years.
Okay, I want to ask about vaccinations. in connection to antimicrobial resistance? Just for us to be clear, if there are vaccinations for a certain disease, it could be COVID, it could be anything. If the target population is not covered, can that be a problem with resistance?
You know, when we're talking about vaccination, I know we are this hype of vaccination. Everybody is waiting for vaccination.
You're calling it a hype?
It's a hype. If we have good infection prevention control, IPC, in place, you don't talk of vaccination. Although I believe in you taking precautions, and it's part of it. Vaccination is not the issue. When you have good system, you don't dump waste where you are not supposed to dump it. You don't take drugs when you're not supposed to take it. You don't fall sick. You prevent yourself from falling. You feed well. You don't need to start running about for vaccination. Fine. As this issue of vaccination, when you are vaccinated, it depends on condition. It's not everybody that can be vaccinated. If you are exposed to that particular infection before, you have the memories. You are not going to be vaccinated. It's when you are not exposed, when you are naive to that infection, that you can be talking about vaccination. That's when they cannot vaccinate you or immunize you against that particular infection. COVID, now talking about COVID, is a problem.
It's a big problem.
It's a problem. This spike, we are talking about Pfizer's vaccine. The vaccine has been rolled out, and it will get to Nigeria, only God knows when. Even though somebody is just projecting in January, we are not sure yet, because they will take care of their people before taking
and they are buying millions of doses.
So we and there are politics. Let me just make good to say that there are politics in the world of vaccination.
So your advice to us is, let's not concentrate so much on the vaccine.
For now, I advise that we don't concentrate so much on foreign vaccine.
Okay.
In my institute, we are working on local vaccine. If we can fund research to the extent that we can bring about vaccine locally, there are strains, and strains are going to be evolving every day. Strains, mutation is going to be happening. We are going to be having mutations now and then. So you design vaccine based on the mutants you have in your locality.
Okay, could it even be remotely possible that we actually get a vaccine, maybe the Pfizer vaccine, and it doesn't work because of the strains we have?
It is possible. It's highly possible. As a scientist, I know when you have mutation in the system, and somebody we have some drugs that are made for our system, for our environment, because we have peculiar problems. Mm-hmm. And we are sleeping here as scientists. We should wake up to the fact that we need to develop our own homegrown vaccine that will take care of our problems. Because all these organisms, they can be our native, they can be peculiar to this place because of our peculiar environment. So those organisms will be taken care of by our own innovative, by the vaccine that we innovate to work against them, or we produce to work against them.
But do we have the capacity to do this in Nigeria?
Yes, we don't have the funding. It's a huge sum of money.
Okay, funding is one type of capacity. Yeah. The capacity I'm talking about
is
capacity. Human capacity and intellectual capacity.
We have more. You and I know that in Nigeria the problem is just funding. Funding that is coming from successive government not ready to fund research, or maybe the paucity of fund. The fund is not. It's better not to even fund than to release fund that will not take care of anything. When you release fund that will not take care of everything, you get stuck along the line, and what happens? You're not going. It's like just going back to square zero. You take one step forward, 10 steps backward. So we should be ready to seek money. Go and look at the money used to bring about this vaccine we're talking about from Pfizer. It's trillion. We cannot. It's more than our budget. How many years? Just total everything. It's more than our budget. Are we ready to fund this? And then we don't know. We fail to recognize the fact that, or to wake up to the fact that this is something that will still be returned economically. By the time you fund the internal research, the local research, and you come out with an innovation, this something will bring something back to you, because it's going to be bought by world over. So I just I say that the funding, that's positive fund to fund research in Nigeria. Government should wake up to funding, to increasing funding of research, local research.
But until that happens, you spoke about infection prevention and control. People are beginning to wonder, does it even work? The NMA is just talking about losing 20 doctors in 1 week. These are people who wear PPE, don't they? What is missing?
Well, you and I, there was a time in this country that even the people they went on strike because the people was never educated.
That is true. That is true.
There's one thing to don PPP. Another thing is to don PPE in the right way. In the right way. I came in here, I saw people, people were just this consciousness seems to be waning by day. The consciousness of the fact that the dreaded virus, and when it gets into you, even irrespective of your age nowadays, if it gets to you, especially the mutant we have now, you agree with me that people are dying more now than the first wave.
Because the strain is worse, isn't it?
It's worse. It's more transmissible.
More transmissible.
It's more virulent, even though it's not as violent as the one we have in UK now.
Okay.
So PPE, fine. PPE, if you can just observe this, for health workers, don your PPE in the best way that it should be done. Then you also be careful, because the way you don't be PPE, you're going to remove it, you can infect yourself. Somebody can infect you. So at the PPE, what's the quality of the PPE? What's the quality of the nose mask, for instance? What's the quality? Even the so-called N95, are we sure that it's as quality as what we used to have? We have made from nowhere, made from anywhere, being imported into the country. What's the quality of the
What do you think is the solution now to, this health worker? I would call it a crisis, because by the time you lose so many health workers, it's pitiable. It's a big chunk of the workforce gone.
Yeah. The IPC I just mentioned before, the Infection Prevention and Control, we should step up. All the guidelines should be followed, right? We need to beef up the activity in our hospital, in our center, in our isolation center. We need to observe something strictly. Observe IPC strictly. There's no fast route. There's no other way to it. When you observe this, and if there's no punity, nobody is cautioning, oh, don't do this, don't do that. You're just doing things because you think you have gone to school, you have been educated, you know how to do this. So everybody, I know that it's a rule that when you are doing PPE, somebody should watch you. Are you doing it the right way? Are you doing it the right way?
That's when it comes to doctors and they're wearing the suit, right?
Yes.
Not the mask is a different matter.
The mask is part of PPE.
But do they have to watch you wear that too?
Yes. When you are they have to watch you wear it the right way.
Okay.
They have to watch you wear it in the right way. And when you are removing it, you have to remove it the right way. When you are removing it, is there this thing in place, IPC? Somebody has to spray you. So that's all those things when put in place we can reduce the death due to COVID-19. Okay,
we'll go on a short break right now. Let's go on a short break. We'll be back very soon. Please stay with us. Welcome back. We're talking about antimicrobial resistance, and we have Dr. Bamidele in the house. Call 0808-054-2233 for your questions, and you can also tweet at CTV_Marie. How do you think COVID-19 has affected the antimicrobial problem that we have? Remember, WHO is calling it a neglected global crisis, yes, which means it's a serious case, yeah, and nobody seems to understand what it is. How has COVID affected it?
Yeah, COVID. People are expected to observe the rule of hand sanitizing your hand. You are using this thing, there will be drug pressure. Even in the time of this COVID-19, you expect people to use hand sanitizer and other antimicrobials, or antiseptic soap, or disinfectant, all those things. So but people, you see that the pressure is more on these drugs. So there will be pressure in the air, what we call drug pressure. And drug pressure gives rise to AMR. So when you have the pressure, the organism is already used to it because it's
Could you explain this pressure? What really is the pressure?
The drug pressure is a function of the amount of drugs that is being circulated in the particular locality.
So because it's a lot,
it's a lot, pressure. There will be pressure in the air. Okay. So the organism is already used to it. Because the organism is already used to it, when you use something next time, the organism is resistant to it. Because the organism is also developing, they are smart. They're also developing ways of circumventing your means of getting rid of them.
Okay.
So when they develop the means, just like the mutation we talk about, it's just because they have been able to go inward and they have been able to go inside and find
engineer
themselves, and they come out with something that you cannot overcome. That's just this. The COVID issue.
Just a minute, a second. Let's take Tui from Oshun, who is calling in. Hello, Tui.
How are you?
Very good, Tui. What's your question?
My question is, we have about 80,000 plus who have contacted this COVID-19.
That's right.
And we have been able to take care of about 60-something thousand. Those that have been treated and discharged.
That's correct.
Now, the question is, this way you heal these people or they treat these people, can they tell Nigerians so that if anybody contacts that thing, we can start applying it?
Okay, Tui. Let's take that to the doctor. Can they test everybody?
Well, we are ramping up. We are ramping up testing, and we are doing better. We are doing better actually. We're able to confirm. Look at the last count.
Yes.
Over 1,000 people per day.
Yeah.
My center test is
up to 50,000 tests
in a day.
In a week.
In a week, yeah, we do that. So we have the capacity, even especially my own station, my own institute. We have the capacity to test as many. But most of the bulk of the people that we are testing now are travelers.
Yes.
Are travelers, so that's the condition before they can travel or come.
And we still have the policy of only testing when someone is symptomatic or traveling, right?
When you're traveling, we will test. Symptomatic is the condition. When you go online to fill the form, you have to be symptomatic so that we manage our resources.
Yes, so there's a segment of people we can't test. Those are the asymptomatic ones. People who don't even know they have anything.
Well, if they don't present for testing, well, asymptomatic means, Australia is symptomatic. You don't know you carry it.
Yes.
Right? You don't express any symptom. You don't show any symptom. They're not going to approach the testing center. But that's the culture here, and that's one of the. When you allow every Tom, Dick, and Harry to come over, your resources.
Your resources, yes. Let's take this call from Daniel in Osun State. Hello, Daniel.
Good afternoon.
Good afternoon. What's your question?
Okay, so I have I would like to direct my question to the doctor there with you. So yesterday there was this news item where it was said that the enemy were complaining that people were not revealing their test status as such. About 20 medical doctors were lost last week. And I immediately thought to myself, how many tests have gone around in the country and how many people even know their COVID status? Since most COVID positive persons are asymptomatic, for us to even know that, okay, this is why we lost this number of medical personnel. So I thought to myself, why not treat everybody that comes into a facility as in a positive case? Treat them as such, so that by the time you are handling them, you take all necessary precautions and don't assume that, this person has COVID and this person doesn't have COVID. In a land where you have so much poverty, how many people can afford to pay the cost for a test to even know this is what is my status?
Okay, so thank you, Daniel. I'll direct this to the doctor. I think this needs some clarification. There were some assumptions there about payment.
Actually, let me address that quickly. Mm-hmm. There's no payment. It's coboless. Let me just say.
It's free.
It's free. It's free at least in my own facility. It's free.
They only pay when they need to travel.
When they need to travel, and it's in private facility that you pay. I don't think there's any payment is being made in any government-owned facility. So that's the rule. You don't pay. But when like I was saying, the issue of testing everybody is not practicable. You can't just tell because it will flex, it will break your resources.
Yes.
You will be talking about 200 million people.
But let me take it a bit further.
Yeah.
We know you can't test everybody, but can you treat everybody as if they're a potential COVID patient with your IPC regulations?
Yes, and that's what we're doing. The government has rolled out, and you listen to them every day, PTF, on COVID, they give rules that must be followed, the restrictions, all the precautionary measures that should be taken so that you don't contract it. You are the protector of yourself. You protect yourself by wearing mask, by physical distancing, by hand sanitizing, by making sure that you don't just because this time of festivity.
Because someone could have it and you don't know.
And you don't know.
But if you've protected yourself, then you have...
I think the chances will be lower, will be reduced. Of you having it will be reduced. Don't go into where people are too many. So keep yourself from crowd.
Let's take a call from Williams. Hello, Williams?
Yeah, good afternoon.
Good afternoon. What's your question?
Okay, yeah. My point is that I wanted to find out, is it possible for the government to take on the testing instead of waiting for people to go to some centers to begin doing those testing? If they can able to get maybe like a mobile app and then go around and do that, I think it will also reduce the height of infection, in the country. I'm one of the engineers that fixed some ventilators. I remember when the pandemic came out at Jos University Hospital. It was on your news too. And also manufacture some disease control system, automatic disinfectant chamber, in which we also expect the government to, maybe if possible, they should come and say we can able to do it locally, but they prefer to go and get it outside the country. We don't know why. So that's just my second.
Okay, Williams, thank you very much. I think...
So let me just... Yeah. I had him, recently, not quite 2, 3, 4 weeks ago, where my professor led us to conduct a study within Lagos State. All the local governments in Lagos, it was several epidemiology study of COVID-19 in Lagos State. I will tell you, the attitude of people were not ready to even be tested, to get tested. It's like this, they have this belief that there's nothing like COVID. Government just trying to bamboozle us. They're just trying to smoke screen. There are people, what is the attitude of people towards
But
testing?
if there's nothing like COVID, how do you explain the deaths?
Yeah, that's the starting point. Lucky enough, we don't have much of death here. And if you were to be somewhere like UK, where you have people even dying, and you see people, they don't have to tell you. You know that this is what is killing people. Maybe because we don't have much of death here, we don't believe that there is...
Okay, so let's quickly talk about how COVID-19 has affected antimicrobial resistance. People are really excited.
Yeah, the antimicrobial resistance, we know now, like I was saying about the drug pressure, we are taking alcohol-based hand sanitizer. So when people buy disinfectants in their facility, in the hand washing station to wash hands, these hands you are washing, the hand you are washing is going somewhere. Okay. You are washing your hand into the community. You are washing your hand and disposing the water into public gutter. Let me call it gutter in our line balance. Okay. Community balance. And people, this gutter, you don't know, that we are not where sanitation about our sanitation here in the part of the world is not there. Top notch. So this thing will get to people. And people, some microorganisms, apart from COVID, some microorganisms, bacteria, they will have developed some resistance. Again, because they are exposed to this thing too much. So they will have developed some resistance to this, all these disinfectants, all these antimicrobial. So by the time you get to human being, it's a problem for treatment. There will be treatment failure because they are used to that, to drugs. So we need to address our sewage system, our disposal. Yeah, we need to dispose whatsoever you are washing, whatsoever rinse, we call it rinse it or hand washing waste. We need to dispose them well, properly. But that goes beyond the level of the individual. This is now a government thing, isn't it? The individual should be sensitized. They should be educated on how to dispose this thing. Let me tell you, government will not come and do the issue of misuse and overuse or misuse of drugs. Is it government? You go and buy, ordinarily, you have a headache, you buy antibiotics. Is it government? You have little thing, you buy antibiotics. Is it government? You don't know, you have not actually been able to see a doctor. To diagnose, even the doctor, empirical treatment. Is that should be? There's no policy in the country that will regulate the way we take drugs. Or that the way we take antibiotics. We have a responsibility to be responsible. Thank you so much for coming to the show. It's been wonderful having you. Thank you also for being there and listening in. Please be responsible. Dispose of your waste properly. Wash your hands. Try not to self-medicate. These things cause antimicrobial resistance, according to the doctor. Have a wonderful day. I am Mary Alale.